So thank you so much for setting up that conversation. I will say this probably multiple times, but if your story isn't being told, your elected officials won't know it. So it's kind of incumbent upon us to be proud of the hard work we're doing and letting them know. And so we're going to go through a couple different ways of advocating, telling our story, and making sure that, that our legislators know the good work we're doing in our communities. So, is that spinning? So we are going to start with thinking about who different influencers are in this space. So things like different stakeholders, the people you serve, different kind of demographics within that, people you'll be talking to, and how you can build coalitions. And so, since I am pinch hitting, I'm going to make a very big ask that everyone kind of do a good participation here. So can I either just kind of popcorn style think of different influencers in this space when you're advocating, telling your story?
I heard representatives over there.
Representatives?
I'm a telltale.
So can we, what would be a little bit more drilled down version of that? Representatives, city and county official? Mayors? All of my elementary school teachers would be disappointed in my handwriting right now. But other folks that are kind of part of the conversation when you're advocating for home care cooperatives. Lawmakers?
I'm not sure I understand.
So the entire country, right? We all have someone at stake in this conversation. And so we need to kind of think strategically how we can maximize those relationships we have, who we're serving. So one thing that comes to my mind would be seniors, right? So thinking of senior citizens, very active. What's an organization that a lot of senior citizens are probably a member of?
Local senior citizens.
Senior centers? Sorry, I didn't hear the last one.
Villages.
Okay. Hospitals, villages.
And the community.
The community. Primary care providers.
Local hospitals.
Yep.
YMCA senior classes.
Would love if you write it. Thank you. I heard did I hear the YMCA? That's awesome.
The YWCA.
YWCA?
Low income senior housing.
Low income senior housing? Yes. Say that again, sorry. Healthcare policy groups, and I heard something else.
Churches and Baptists.
Yep, churches and Baptists.
CDCs.
CDCs, pastors.
Are we going to talk about those that can help us, affiliates that we can tap as well?
Say that last again?
NDWA, the National Domestic Workers Alliance.
Yes. NDWA, National Domestic Workers. So they're kind of a similar trade association like AARP, but for domestic workers. Department of Aging, Council on Aging. Yep.
Hand in hand. The
Hand in hand.
employers, the Domestic Employers Network.
Domestic Employers Network, okay? Awesome. Other folks, we had a little faith-based, kind of more broadly as well.
How about adult protective services?
Adult Protective Services.
Healthcare unions.
Healthcare unions, yep.
Residential facilities?
Residential facilities.
Do you have attorneys that prepare wills and power attorneys?
Attorneys, yep. Folks in that similar vein, like tax professionals.
Trade unions.
Trade unions.
There's a large amount of the population aging out of trade unions right now.
Yes.
Hospitals.
Hospitals. Veterans groups. Yep.
Financial planners,
Financial-
succession planners.
Yep, financial and succession planners. So these are a lot of the coalitions, right? So kind of these power in numbers you have every part of your community involved in this arena, that making the case to lawmakers, you can show all the different folks that their policies are impacting and why they should be encouraged to be more proactive and make sure that policies are actually working for home care cooperatives, right? Does anybody have any other last burning influencers? Yeah.
This probably just goes with hospitals and healthcare, but hospice, directly up to hospice.
Hospice. Mm-hmm. That's also right. Say it again. DMEs, durable medical. Mm-hmm. Yes. Yes.
What about health and human services?
Health and human services, absolutely.
Medical equipment rentals.
And rentals for medical equipment. Mm-hmm.
I think getting more referrals to some housekeeper types, like the maid service or
Sure.
whatever, who's just been cleaning, and then it's like, this is really more than just cleaning the bathroom.
Yeah, so that domestic workers networks. Mm-hmm. Yep.
Community leaders.
Community leaders. Yep.
The Center for Medicaid and Medicare.
Yes. Center for Medicaid and Medicare Services, CMS. And sorry, WorkSource. Yep.
SEIU.
SEIU, yes.
How about families of patients?
Yes, yes, families of patients, those people who, you're impacting the lives of their loved ones, they can tell those stories too, and you should encourage them to do so.
The other thing is, it's not all seniors. I have
Right.
a huge population of kids who are autistic, so the school system has started reaching out.
Okay, school systems,
And
interesting.
there's a respite coalition.
Okay,
Disability and ability organizations.
disability and ability organizations,
Developmental disability,
and development.
DDA.
Yeah, Esther?
U.S. Federation of Worker Co-ops.
U.S. Federation of Worker Co-ops. I'll also make a plug for NCBA, we can be of assistance.
So regulatory bodies, I mean,
Regulatory body, so what, can you expand a little bit more? Yeah.
state regulatory bodies, maybe medical boards.
Medical boards, yeah. Other thoughts? This is everything I could have asked for participation, so thank you very much. Awesome, if there are no more additions,
Workforce development.
workforce development, and I heard another one in the back. Sorry.
Community-based organizations.
Community-based, yep, community-based organizations. Sorry, there was a cough when you spoke. Go ahead. Independent living. Thank you for taking this. So we are going to talk about using these organizations where you can build partnerships to tell your story, to make your ask to legislators at the city level, state level, federal level. This is a very complex issue. As you can see by the number of stakeholders, there's not one body that you can go to, right? So the only way we will conquer this is to use all of these connections that we have, all of the lives we impact, and kind of get everyone on board to be advocating for this issue. So we will go over a little bit more of kind of the legislative issues that impact home care and home care cooperatives. And then we'll have, just to kind of give a little bit of a layout of the rest of the afternoon, we will, so first kind of some specific policy issues that I'm sure will come very naturally, the things that you would like to be advocating for. And then we will have a couple folks who have some experience in advocacy and have done this in home care space already, so they'll speak a little bit about their experiences. And then don't think the participation stops there, because we'll do a kind of a workshop and hopefully to get, so it's useful for everyone here, a little practice of kind of what you would like your message around your home care cooperative to be, and apply that to an issue that you'd like to advocate for. So that's a bit of the layout. Leslie, am I missing anything? Okay, so with that, can I have Allison and Terrell come on up. Yes. So, Allison Cook, the New York Policy Manager for PHI, and Terrell Cannon, the Director of Training and Workforce for Home Care Associates. We are going to start out with them giving kind of a brief introduction about themselves and their work. I will kind of start out with asking a few questions to kind of get the ball rolling, and then we'll open it up to the audience so you all can ask your questions as well.
Thank you, and thanks for having me here today. My name is Allison Cook. I'm the New York Policy Manager at PHI, and I also worked as a home health aide while in college, so these issues are very personal to me. First, I'll start by telling you a little bit about PHI for those of you who don't know us. Formerly the Paraprofessional Healthcare Institute, now we just go by our acronym, PHI. We're a national nonprofit headquartered in the Bronx, and our mission is quality care, quality long-term care through quality direct care jobs. And we achieve that in two primary ways. One is through our policy team, which I'm a part of. So that includes policy analysis, some advocacy, and consulting in the policy realm. And then through our workforce innovations team, which works directly with workers, employers, payers, to really implement a variety of interventions and trainings. So our policy team, I'll just tell you briefly, I focus on New York State policy and also localities within New York State, but I will look at things that are happening in other states and bring them back to New York as examples of what to do or maybe what not to do, as well as bring examples from New York to other states. And I personally do a little bit of federal policy work, but we have our Vice President of Policy also work on the federal side. It's also important to note that our sister organization is Cooperative Home Care Associates. So we have a very close relationship. So I think I'll stop there and I'll answer some questions shortly.
Thank you. I am Terrell Cannon, Director of Training and Workforce Development for Home Care Associates. I too was a home health aide and I still provide direct care work when needed. In my role, I supervise the home health aides. I look at policies that affect the work of the direct care workers and bring initiatives to try to get those messages out to our legislators in Philadelphia so that we can have these conversations and possibly make change that will better the lives of direct care workers across the city of Philadelphia, not just in Home Care Associates. We work very closely with Allison and PHI as our sister company, as well as Cooperative Home Care Associates. So we are really passionate about, again, quality jobs and quality care. So in order to instill that the workers are providing quality care is to instill in the worker to provide a quality job for them. And that's not just inside the home or inside the office. The quality job transfers into their home life, because if they're comfortable at home, the quality of the care will transfer into the work that they do.
Awesome. Thank you so much. So I will start kind of broadly. So kind of starting with, in your work, primarily, who are you, we're going to use the L word, lobbying. It's not a bad thing, I promise. Who you're lobbying, who you're advocating to, and kind of what the top 2 or so issues are.
So I'm going to start by partially answering your question. We do some lobbying, and that's really, lobbying is when you're asking for a specific law to be passed. A lot of that work is honestly around the budget, because Medicaid is the largest funder for home care. But we also do some advocacy work that's not considered lobbying. So when you're influencing, for example, how regulations are structured, that it doesn't require a law change, but it's how a law is implemented. That's not considered lobbying exactly, but can also be very influential and also not necessarily take as much time and effort, which is important because I know all of us, including myself, have a limited capacity. So 2 biggest issues. It's hard to choose just 2. I will say one of the biggest issues that we're seeing both localities, so cities or counties, as well as states struggling with, is the workforce shortage. The challenge is that there's no one solution. There's no simple solution. But we're starting to see, for better or for worse, the impact of the shortage on both home care companies and home care consumers, home care clients, so that lawmakers and others in the policy realm are taking notice. That was only one, but I'm going to leave it there for now.
I might mention the other. For us in Philadelphia, along with the shortage, what we're also challenging is the wage increase of minimum wage, where the cost of living, again, continues to rise, but at the same time, we want to offer our workers sustainability. So, you don't want to, we're arguing, do we pay them this $15 to $19 an hour, or are we going to say, okay, we're going to do 12 to add the benefits and the essentials that's needed to live, so that's not coming out of your $19. That argument is not just, again, I think it's a national argument, but in the city of Philadelphia is real prominent because a lot of our workers with the shortage will then now, someone can say, well, I need the money, and you may find that they left home care to work at McDonald's that's paying $19 an hour, which is really not their passion, but because the way that it's been set up for them, there's a lot of advocacy work that has to go into fight for the things that's needed with the cost of living versus just paying someone an hour. And we're, again, not like you said, not just lobbying it because ours is driven through Medicaid as well, but we do a lot of advocacy work and making sure that when those meetings are coming up in Harrisburg and so forth, we're not invited, but we go anyway. So that our voices are, can be heard because there's, power in numbers. So we take those opportunities to just show up. And again, we look at our budget to see if this is something that we can do. Are we going to take 50 home health aides with us, run up to Harrisburg Day after meet? We need to interrupt. How in our budget can we afford that and not take away from the workforce or the company or the consumers to be able to do that, to fight for the bigger picture.
I think you touched on a great point that lots of people in the advocacy world have cited, but if you're not at the table, you're on the menu. So really just hitting home on the importance of showing up and being there and fighting that, in this case, funding. So in both of those examples, do you talk about how cooperatives are a bit different? And if you do, how do you kind of go about talking about that?
So definitely.
Or cooperatively, or organizations who operate cooperatively minded. Because I know some folks aren't.
Yes, and I think lawmakers and others typically want at least some employers at the table, and cooperatives are a great option for them because not only are they providing hopefully quality services, but they're also investing back in the community. And that, first of all, really appeals to legislators because you're serving 2 different groups of their constituents. But second of all, really brings richness to the conversation around the table because it's not only one perspective or the other. Cooperatives tend to blend those 2.
Has a mind of its own.
Was there a second part to your question? Did I answer it?
Yes. How co-ops are, how you talk about co-ops being a different business model, better business model, and why legislators should support that.
Yes, and I think the other piece is when you're talking about the workforce shortage, you need to make these jobs attractive in some way. There's often limits, especially for those who are primarily funded by Medicaid, in terms of what you can pay. But there are those other benefits that having a co-op can provide. including worker ownership and the other supports, really supporting your workforce that can attract more people and keep more people in this field.
I can mimic what, like I said, we have a really close relationship with PHI, but and part of how we let people know how cooperatives work, when someone comes to Home Care Associates for a job, we have an orientation about the company. And in that orientation, we talk about the company being a co-op, the worker ownership, how it's set up, what the benefits are between a co-op and a business that's not, so that they can understand the difference of the two. And some people choose not to buy in, but then you have others that think of longevity to say, hey, I want to age here. And aging here means I will need these essential things that the co-op provides, and we get a lot of people through that way. And with that, we bring in workers that have made the choice to have that longevity with home care, to again tell their experience between working in a co-op and working in an organization that's not a co-op, so that they can have real-time experience to understand the decisions they're making when coming into a co-op for longevity. So knowing that in a co-op, there could be changes as we go along in regards to how legislation moves. We're going to move sometimes in agreement or most times not, to fight again for the rights and lives and better the lives of the workers in our co-op.
Mm-hmm. Now, there have been kind of task forces at the city and state level kind of popping up in different areas. Can you talk about, if you've been involved in them, what that's been like, and what kind of the value is in being part of that conversation?
Sure. PHI actually just published an article on some state level task forces that have been convened in, I think it was 12 different states over the past 10 to 15 years. Not surprisingly, there were very common recommendations that I'm sure those in this room can list off, related to wages and benefits and career advancement opportunities. In terms of participating in them, well, actually, I'm going to take a step back. It's important when we're thinking about advocacy and policy work to think about local, state, and federal. And depending on your capacity, determining which of those you want to focus on more. So for the state level task forces, often it's about having that existing relationship to be invited to the table. But sometimes it can be as simple as asking to be a part of the table, or have a seat at the table. I also think at the local level it can be a little bit easier to get involved. We're seeing more and more localities, whether they're cities or counties or even regions within a state, realize they need to take action too. So for example, in New York, there's been efforts in New York City, in the Finger Lakes region, as well as in the Hudson Valley, all seeking to figure out what those localities can do to make a difference. So I'll turn it over.
You pretty much said it all, but in we've had we're participating in a task force with in regards to our Pennsylvania lottery. $1 supposed to be going to our elders, and we found elders were struggling with stuff. So in that task force, what we did, we got with a lot of different other co-ops, workers, companies, and again wrote letters and things like that to our legislators and councilmen, ward leaders, and all of that, for them to begin to have a conversation and saying, hey, why isn't this money 100% going to the elders as it should? And the same with, affecting the workers. We have a beverage tax that affected our workers in regards to them having to come out of pocket, pay more for this. Now they don't have it for childcare or can't, get the transportation and things like that. So there's different task forces within our county that we sometimes don't get invited to, but we're very aggressive with just showing up to have this conversation about rearranging where these dollars are going, because like in Philadelphia, we took the beverage tax, closed the schools, now where the kids are going. And our workers are affected because now they can't work every day or they, like their normal hours, because they have to go and get the children. And, you know, we can't hold them accountable for that to get their kids. But why set it up in a way for people to fail? So on those task force, we go in, like I said, we write letters, we show up, we make phone calls, we have, you know, developed a uniform letter, thank you PHI, for people to sign and send over so that we can at least begin to have this conversation. There's no one solution to this, so it's got to be a collaborative effort to get these things to the table, to be able to have these discussions, to at least see some hope.
So I think you both
Actually, it made me think of one other thing. Sometimes the groups that are being convened might not be the exact fit, but you might need to be at the table to be like, and what about the workforce? So I'll give an example. In New York City, there's an initiative called Age Friendly New York City. And now they're rolling out individual initiatives in the different boroughs. So I was talking to someone who was leading Age Friendly Brooklyn, and I was like, so have you thought about home care as part of that Age Friendly initiative? And they were like, well, we haven't yet, but now that you brought it up, I'll talk to you about it. So sometimes it's just being at the table or talking to the right people and kind of planting that seed.
Yeah. So both of you have discussed a little bit about kind of getting that first accomplishment, right? Whether that's funding or whether that's specific legislation getting passed. And I am a big proponent of celebrating those wins for a while. But then at some point, right, you have to turn into that implementation phase. So can you both talk a little bit about what maybe challenges you've had after you've gotten legislation passed and how that's been implemented, or different challenges with funding and how you kind of advocate around it?
So, for example, in New York State, we passed a law after much advocacy. I will say something that we haven't touched on yet is it's really important to work in coalition with others. Whether that's a trade organization or community-based organizations or other providers that just share a similar perspective. So PHI and a number of other organizations worked very hard to get a law passed to create an advanced home health aide occupation that would allow these advanced aides with additional training to administer certain medications. Now, that was in 2016 that it was signed into law. Just this year, the regulations were passed. So you pass the law, then you have to go through the regulatory process, and then it's actually implemented. You have to go through that process. So the regulations were finalized, and due to a number of challenges, no one is really planning to implement this role, which is very demoralizing. But what we're doing now is really working with some of those partners that we worked with to begin with to pass the law, to say, now how do we fix it? So sometimes it's 2 steps forward, 1 step back. Sometimes it's 1 step forward, 2 steps back. But with policy, you have to take the long view. So we're working with partners to see, well, maybe we can get funding for a pilot program to show what does and doesn't work and what needs to be changed. Or maybe we need to think about changing the regulations or changing the law. So I think that was an example of you need to take the takeaways are, it's a long process. You need to take the long view, and it wouldn't be possible without working with partners, because none of us, even me, who my full-time work is policy, I don't have enough time in the day to do all that needs to be done.
Same exact in Philadelphia, where regulations are now coming through for us to have that, to provide that occupation for workers who are getting that added skill for the same thing as for medication.
So I'm going to pause there with my questions and open it up to see folks in the audience what questions you have for our panel. and ask for participation again. Yeah.
Okay, so like from a layman, if I've never approached policy before, and I don't really know where to go in my local community, like I now know I could reach out to PHI or one of you guys for some guidance, where would I want to look first to figure out like what's going on in my state? Like what's my first step? Like that's my question.
I think that's a good question. I think first, when thinking about advocacy, first you have to decide how much time you want to spend on it, because you can spend as much time as you'll give into it.
A full-time job's worth.
Yes, more than a full-time job's worth. So once you first think about how much time you can allocate to it, you can kind of think about your options accordingly. And I guess how much time and what level you want to start at. So do you want to start with your local policymakers? Do you want to go to the state level? Usually people don't want to start at the federal level, but you can choose to do that if you want to. And that determines where you want to start. I think, as I mentioned, working in coalition with partners is very important, not only for achieving those goals, but also for kind of staying on top of what's happening. So maybe there's a trade organization, maybe there's a community-based organization that does a lot of policy advocacy work. And no, I think I'll leave it there. Did that answer your question?
We'll go over that a little bit more as in kind of the next part. Before we work on crafting our own messages, I'll do a little bit more kind of in-depth of like Google is your friend and like different ways to find those and like community newspapers and things like that. So we'll have a little bit more on that in a little bit as well.
Yeah, and I will add that legislators do want to meet with their constituents. So if it's a local legislator, it's usually much easier to get an appointment, but even state level and federal will make time.
Speaking as a former federal staff member, they make time.
In your own entity, you can create your own policy action group with your own workers so that you can have a practice of discussing and talking about the issues at hand. So when you go to those entities you're going to be speaking with, whether it's local, state, federal, you'll be able to go with your discussions lined out and have a goal set, so you know at least you're meeting something when you go. So it's good to have that form, and to take it back to this morning, some of those members can also be members that are part of your work ownership.
Yeah, and I'd just like to emphasize that having the co-op piece or the workers focused piece, where you're both providing care and investing in the community, makes it much easier to get meetings with policymakers.
And you're a small business owner, right? They always say they want to talk to small business owners, so claim that. There's a question back there?
Yeah. I know that the census is coming up. And the last time we did it was 2010. And so we've been working with this demographic data. We're literally in the homes of the people who've aged on average longer than the population used to. So what I'm wondering is, how long will it take for the census data to be out in the public so that we could say, we've been telling you this for 5 years, there's the trend. Do you think we can kind of finish planting seeds so that we're ready to, so that policymakers are ready to attach funds to what we know to be the needs and have that, not wait 5 years?
So there's always a delay with data. That's one of our big challenges in this field. And one of the things that PHI has advocated for is not to only have the census as our source of data. I'll try to talk loud. So I think part of the advocacy that PHI has been doing is telling localities and states, yes, the census is very important for a number of different reasons, but how can you collect better data in between the census? Is it a regular survey? Is it using maybe you can use unemployment insurance data or disability insurance data or background checks. Usually there's a background check database that can, if you pull all of these data sources together, give you a picture of the workforce and those who are being served. I think another challenge with the workforce shortage is that we know there's a shortage, but it's hard to quantify exactly how big that shortage is and which areas that shortage is the worst in. We have anecdotal data. We live it every day. We see it, but a lot of time legislators, they want that hard data. So I didn't give you a great answer. There's going to be a delay. It's just the nature of this work. But I think you should not only, when you're thinking about your advocacy, include that data piece in there.
I will also, a lot of the census is responsible for allocating billions, if not more than $1 trillion. And so two big programs that I think home care and cooperatives more broadly overlook are community development block grants and community service block grants. And being part of, so your state, that money goes right to the state organizations, and states they have to give a plan to the federal government, but they have to map out what they're going to do with that formula funding. And so they take input from stakeholders on what those dollars should be implemented toward. And so being a part of that conversation, being at the table, saying we should be dedicating resources to our aging population, to our population with disabilities, and making sure that co-ops are a part of that as well. So again, we kind of avoided the answer on the census.
Okay, you did.
But again, just as they have that data, making sure we're kind of reinforcing more.
And what some folks in New York are thinking about is also looking at how economic development funding might be used in a limited way to invest in the workforce.
Can you repeat what you said, the community development block grants and?
Community service block grants.
Okay.
And it just kind of depends on the states, which ones they use. I know I'm from Wisconsin and we focus a lot on CDBG, but other states use CS. Yep.
To hear more from Terrell about how you inform and educate caregivers on the policy issues, and then also when you talked about sending like 50 people to address an issue at a meeting, how do you actually logistically rally those people to go?
A lot of we have a policy action group, and with our organization, when a person when they first come in, we introduce it. When they reach 3 months of employment, we go through worker participation training, and we have a member, again, this is a worker owner, that's on that committee, present to those newcomers. Once they present to those newcomers, if let's say you're interested in the policy action group, we go through a little survey to see how much it is you know about policy action first, so we know where we need to educate you. We often with everybody give all of, understanding Congress, understanding House versus Senate, understanding, the Bill of Rights. We give them all of that information in that training first, and then we bring forth the issues that are on the board or things that's going to be laws and hopefully passed or not, and we then do a census ourselves. Okay, what issues are we prioritize? So once we get in agreements together, the issues we want to prioritize, we focus on that. We call PHI. Get some support and making sure in the directions we're going to we're going in the right direction, and then we initiate that initiative. And to get those people to go with us, we have the members and the workers. We do, like we made a lot of our aides get direct deposit. We'll let them know a couple weeks in ahead that direct deposit not going to happen, so everybody has to come in to get their paychecks. So when everybody comes into the office, we're like cheerleading, hey, we got this on the table, we need to talk about it, and people get riled up and interested, and we have our letters there, we read them, we explain to them what's happening, what's going on, and that's how they get on board. And then we actually, because of, again, they still have to live, ask them to go is voluntarily. We can't make them go, but the appointed members must go. And then we have, we say 50, but it's usually about 100 or so that goes. And then we all, go and do that advocacy work to try to get our voices heard, our stories told, so that they would understand.
And I'll just add, I think most people already know this, but I just want to emphasize that having workers there really does, having them tell their own stories and why whatever issue you're advocating around is important, really does, especially for legislators, kind of bring the issue home.
And I will just add another note of kind of putting a fine-tune on note on it, of seeing it as building a relationship and less transactional, because for better or worse, some of them will be there for a while. So let's build a relationship, early on. I think we have time for 2 more questions.
Maybe one, but maybe Terrell. Are you as a co-op able to engage your clients more, and do they participate in some of these actions, or letter writing campaigns or whatever else? Have you ever been able to engage the seniors or their family members?
Yes, we also have our consumer participation meetings, and that's a chance because our consumers like to get out sometimes. The aides get to bring them up to the office. Sometimes we give the workers literature that they can share with the consumer. But if the consumers are interested, we don't push, because we have to also consider their medical condition, if they want to participate and so forth. Some of them sign the letters to send them out because it affects them in the areas they live and so forth. And then we continue to do that. We let our consumers know just as much as our members do, so that they feel as if they are not just receiving service from our organization, but they are a part of our organization.
Okay.
So you're coming full circle back to what we were talking before about different places we can legislate. I kind of have a crazy idea, some of this is ridiculous or this is valid. I've been involved in several audits for other computer companies, and looking at the hours servers and the number of surveyors, I'm looking for 75% committed number of hours to serve is, right? You don't keep those hours or some kind of penalty. Then we talked before about there's a huge need for more caregivers. But it really bankrupts. A lot of our carriers have to go through the certification process, like $1,000 up to we're talking about before this can be a license. Places like MIT, other colleges are making their courses free because we have a shortage of skilled labor in our country for various things. And the problem is that we work in a field that is secretive and private in people's homes. The data that we're talking about doesn't come out for 5 years. So is there a way that we can petition, since the state agencies are so intensive about our information, can we petition our own departments of health to come up with what is the hours missing every year in all these agencies? And they come up with how much care is being served. We get free classes that are some kind of benefit for free education, for certification for
Absolutely. If you can convince them, please let me know. So I've worked with the New York State Department of Health. I've had a number of conversations with them. They don't know how to measure that gap. It's challenging because there's the private pay market where they might not know. There's not really a good way to collect that information. Then there's the Medicaid, and if you have managed care plans that are administering Medicaid, sometimes they house the information, sometimes the home care agencies might have some information. So there's not really an easy place to grab that. But we're working on it. And if you come up with a solution, let me know.
Awesome. Well, please join me in giving a big round of applause to our panelists. And next we are going to hear from some folks who have already had some experience in this. So please welcome Yvette and Becky Kaler onto the panel.
I just got to tell y'all about these kids, but I got
Well, we will start out kind of the same way as the last panel, so if you could just give an introduction about yourself and maybe just start to touch on the kind of places and issues that you've advocated on, and then we'll get a little bit more in depth as we go.
My name is Yvette. I've been doing home health aid almost 40 years. My name is Yvette. I've been doing home health aid almost 40 years, but I started off as a candy striper. So that's what really got me into it. As I became a candy striper, I worked with disabled children. Just like when we were going on hard times, it closed down. I had to go on welfare, and when I went there, they like basically wanted my whole life, and I said, this is not for me. So I was actually at the welfare office arguing because the lady was asking me 50 questions. I said, well, what about all this money I pay in taxes? And people can walk right in and get it, you gotta confess I'm not having it. So I walked out the office. And I came to Home Care Associates. And I've been with Home Care Associates, I know they said 13, but I've been with Home Care Associates, the company was 2 years old when I started. Yeah. And the first time that I went to Washington, I was so nervous. I didn't know what to say. Who would listen to me? But then I put together me of being on welfare and also a candy strike. I said, you know what, they won't hear my voice. So the company can tell you, sometimes when I start talking, I talk. And you're not going to shut me up until you want to hear it. So actually when we went there, they called right close or whatever they called it. So we was talking, I was passing the man an envelope about my life. So he was like, so I said, excuse you. I said, are you going to take this folder and put it in your drawer or you going to read it? And he's looking around. No support because my gang is here. The home health aid is here. So he said, I said, are you going to promise me? So he was like, I don't know. I said, well, you have to know. I said, but I'm not leaving this office. So he promised me. So they said, well, he'd reach out to shake my hand. I said, oh, no. I don't want to shake your hand. I'm going to hug. So he gave me a hug. So as I was walking the office, I hear him over my mouth. I said, just imagine, you're going to get old someday. I'm quite sure you got a mother or father going to need the aid. Fight for us. I said, you know, I'm home health aid and I'm skipping medicine just to save money. And the secretary and everybody was like so happy. And it gave me the encouragement. I said, if I can speak to them, I can speak to anybody. Wow. We got to keep fighting. We got to.
I'm Becky Kaler with Cooperative Care in very rural Wisconsin. So I started as a caregiver, worked my way up in the company. I'm now our board chair and one of three of our management team that kind of run the day-to-day operations. And in May, I was asked to go to Washington to meet with some of the state representatives from Wisconsin and also to participate in an interagency working group. So that took me way out of my comfort zone from little tiny Watoma, Wisconsin to Washington, D.C. and having to speak in front of all of these people and all of you here, kind of, you know, it's not my forte. So what gave me a little bit of confidence in going into those meetings and talking to people is just knowing that I'm the one that knows my story the best. I'm the one that can tell it the best. And so that's what I did going into those meetings. And it was a little rough at first, but once I did the first one and kind of got to the second one, it was a little bit easier.
I've also been there. I disagree with it being rough, but both talk about, you talked about a little bit of discomfort, right? So can you expand a little bit on that? Like what about it was uncomfortable and at what point were you like, no, they're here for me. I'm going to tell my story. Can you talk a little bit more about that experience?
For me, it was just I'm not a very communicative person. I don't like to talk to people I don't know. And it's not that I don't like people per se, I just feel very self-conscious about what I'm going to say. Am I going to say the wrong thing? And so to meet with somebody that you like, I mean, you see, like, I was meeting with Tammy Baldwin, and I see her on TV, I see her commercials, and what does she want, what am I going to say to her that's going to matter? Or, but then to know, like, they work for you. They're there because you put them there, and it's their job to listen to you. So that's, to know that helped me. And then to just have a little bit more confidence in knowing that what we're doing makes a huge difference in people's lives. And so for me to be a little bit uncomfortable, to make sure that other people get taken care of, made the difference for me.
My first time I was very nervous. There's these people with their PhDs and all this stuff in here, I'm just really bad. When, like I said, when I went there, I had a voice. So then I said, you know what? Here go that magic finger, voting. And this magic finger can pull you out. And I said, if they can, you know, like with home care associates, not only we as our aides, we try to register them to vote, the younger. We push that a lot. And I said, if I'm a voter, why can't my voice be heard? So I'm telling you, I was so nervous. But as I got through that one person, everybody else was a target. So, I've always been a people person. And I never was afraid to talk, but I was afraid to, like I'm doing up here now. Everybody's there, but I learned to focus. I learned to open my mouth. I learned to have a voice.
Can you both talk a little bit about what you did to prepare for the meetings?
To prepare for this meeting, I dwelled on, last time we joined together. And listening to some people's stories and stuff like that, so I watched the news. I kept drilling myself and said, well, you know, be yourself, answer yourself. So I just started going back over paperwork and focusing how did we handle it last year. And that's how I prepared myself. I'm gonna ask questions, and as you know, some of y'all probably stopped and talked to y'all, and just to get familiar with everybody's faces. So that's how I prepared myself.
I kind of went through some of the history of cooperative care, how we got started, why we got started, why was it important for us to be established in such a rural community. And then from there went to kind of a more personal impact kind of route, as far as like some of our clients that we see, we're their only contact. They don't go out of their homes, they don't go anywhere. And so if one of them were to fall and break their hip, nobody else is gonna know. And if we don't show up, what's gonna happen to them? So to make that, that important impact, that if we're not out here doing this work, what's gonna happen to all of these people? They're just gonna be neglected and die in their homes, and nobody's gonna know about it. So just the impact of that is what I did.
Can you talk about anything that maybe surprised you in the meeting, that maybe you were expecting one thing and it turned out to be something a little bit different?
Well, the first thing that surprised me, there's more people this year.
Yeah.
There's so many more people, and that surprised me. But what surprises me that how from the last meeting we had, that some people came together, and that people was listening, and people was taking ideas, and people was willing to take a chance. So, like I said, when we left this meeting, we did have visitors come to Home Care Associates, and they took the ideals, and they're running with it. So what surprised me that people listen, we did reach out to each other. That was surprising me, that we just didn't leave here. We stayed in contact.
In the meetings that I had, I was very surprised with, once I got in there and got over my fear, how easy it was to actually talk with them, and the back and forth that was there. And with Tammy specifically, she was really interested in the story of cooperative care and the services that we do, and she asked a lot of questions of me. So I was really just surprised by getting over my fear and how easy it was once I got over that.
Thank you. I will open it up for folks in the audience who want to ask questions.
Question now.
You're not getting off
You talked about going, getting fed up with the welfare office and going in somewhat demanding the job. How did that turn out? Did you get hired for that job? When you went into the
When I went to the welfare office to seek help, and I see they want my whole life story, you giving me a runaround?
Yeah.
I worked for this. So, like I said, I didn't wait for welfare reform. I reformed myself. I walked out there, started looking in newspapers and stuff like that. So it happened, well, she's gone now. The lady introduced me to home care. Her name was Lee. They called Leo. And she introduced me to home care, and I came in, we did the classes. I had some experience. I'm like, I'm going to fail this, and now I got to go back down into welfare. I said, I'm not going back down there. So I went in that office, and I never turned back around. But when my clients need help, I said, go to welfare. I'm fighting. I mean, come on, this is what we pay taxes for. We pay taxes for it, and I'm just going, just like the school lunches. Excuse me, I hate it. Why should a child, I know that's wrong Southern, but I'm against that too. No child left behind, no child should not be fed.
Right.
Other questions? Yeah.
So my question is for both of you. Before, like you said, you had another job before you went into cooperative home care associates and you as well. What would you say is the difference for you, each individual, that you feel about the job you used to do before you went to a job that is a cooperative and the way you used to work in another regular job?
Well, when I first started working, it was just go in and do your job. That's it. You ain't got no voice. But once I became more cooperative and seeing how they let you have your voice and how that we can pour out from a certain group and make our own group, it helped me out a whole lot. Because when I used to work, I didn't have no say-so. You get up, go clean the patient, get paid, that's it. There wasn't no voice. But with cooperative, it helped me out a whole lot. That we were separated, not separated doing jobs, but separated how to handle certain situations. And it gave me a voice.
Prior to cooperative care, I worked at an assisted living. So there was two things I didn't like. One, I didn't like the human assembly line feeling of get up, and you didn't have any time to be personable. So I came to cooperative care, not really even knowing what it meant to be a cooperative. I just liked the idea of being able to spend more time with the people I was taking care of and to get to know them on a personal level versus just being very routine oriented. To the cooperative aspect of it, I didn't realize that there was a company that I could be a part of where I would be able to have a voice, to be able to have the personal growth and development that I've had, because 10 years ago, I would have never even dreamt that I would, be up here talking in front of you guys, or to have the opportunity to go to Washington and to be in the Capitol and to do all of those things. To go to LA last year to speak out there at the U.S. Federation, to do all of those things that I've gotten to do as being an owner of a cooperative. Never in my wildest dreams would I have ever thought that that was possible if I wasn't a member of cooperative care.
So I imagine both of those kind of came up in your meetings with your elected officials. Can you talk about kind of what issues that you brought to that conversation? What were kind of the asks that you had of them, or things that you wanted them to know after you left the meeting?
So I spoke a little bit about that earlier, about just the importance and the impact of the work that we do and the consequences of what could potentially happen if we're not out there doing this work. So I really wanted them to take that away from my conversations, but then just to also understand that the people that are doing this work are invaluable and that we completely deserve more respect than what we get. So the only way we're going to get that is if we demand it and ask for it.
And also, when I went, I not only went for home health day, I went for my clients. And I just started talking to them and I told them, I said, look, I'm a home health aide. I'm out there facing danger. I'm going places that I shouldn't be just to earn a living. I have clients who work all their life, can't get nothing. And so I basically told him, I said, let's go, I got an itch. Basically, I said, listen, home health aid is not just home health aides. We have nurses and doctors, but we're the front line. If we go on a strike, you think, I'm not saying all nurses, because we do have nurses, who's going to come in there and clean these people? Who's going to come in here and listen to, we're not only home health aides, we're home health aides, we're counselors. Sometimes they call us their daughters. You know, these are things that people got to realize. We're going to neighborhoods that people don't want you in. So the whole thing about that, you know, come on, we need you, we need us. We need to be taken care of. Our clients need to be taken care of. So I fought for a lot of stuff, and like she was saying that I would never thought I'd be sitting up here doing this. So I knew if nobody else didn't listen to me, I knew somebody did.
You guys both talked about sort of that transformation of never imagining being up there, and I'm just wondering sort of whether that shift was internal and sort of just believing in yourself, or if there were things that people did for you, ways that you were supported, things that people said that sort of gave you the encouragement to open up and step up and kind of step into this role of speaking out.
Absolutely. You were just talking to me before I came up here about how I can do this. It's okay, because I don't have confidence. I kind of just grit my teeth, clench my fist and get up here and do my best, because I really don't like it, but I know that it's important to do it.
So I would never thought I would be up there. But just being on the board, talking to some people and listening to them, and when they first told me, Yvette's going to speak, I was like, Yvette's going to speak, who did I do? And it says, so somebody said, well, you must have talked to somebody, and they really like that. So they said, well, what do you talk about? I said, well, everything I always talk about is better job, quality job for quality people, and we're going to fight this. And then I said, you ran your mouth too much. And then you got to sit up here and talk. And then, I said, well, guess what? I'm going to talk. I'm going to be me. Rather, I got a little country talk, so sometimes I talk a little fast. That's just every darling. But I was really nervous, but I'm so happy to sit up here and listen to our story from the inside and out. But we need to basically go to Washington and stuff like that, form a group there, form a group. And I remember this organization said Liberty. I went to Washington and sat on the ground for them. This is for disabled. Now I'm the aide, and they're like, well, I said, I'm sitting down too because I'm part of them. And we sat on the ground and we blocked doors.
Great, great, great.
So, now that you are like seasoned vets at making your voice heard, how do you influence the newcomers that feel the same way, maybe not as confident in speaking, who don't know the opportunities? ahead of the youth with our youth mayor voices? Like, how do you influence and empower those that?
So I'm a senior mentor. I don't know how I got picked up that, but I'm a senior mentor. Go perform workshop, look in the mirror, try to talk to people. Like, I'm willing to talk to anybody that's saying, well, how did you have the confidence to do it? I'm willing to help. And just say to yourself, I want my voice to be heard. I want somebody to hear my side of the story. All our stories can be the same, but somewhere your story is different. Have confidence in yourself. When I first started speaking, I was shaking. You thought I had the chills. But like I said, form a group, willing to talk. And if that's what you want, you speak up. You're not afraid of nobody. Speak up.
Just to say, you know your story better than anybody else, so you're the only person that can tell it. So use your voice and speak it.
So one thing that has come up in kind of both panels a little bit is limited time, limited resources. So I'm wondering if both of you can speak a little bit to kind of the benefits or trade-offs that you have found, both advocating yourself and participating yourself versus being part of an association or kind of just supporting coalitions, how you kind of, how you see that trade-off.
I see the trade-off good. I'm learning now to go into my community, speak to people, knock on doors are shut. I think around about 4 or 5 years ago, I went to City Hall, we call it City Hall. And I had a little problem, but they shut the door on me. I sat in the hallway. I waited for the person I wanted to talk to who came out. I said, excuse me, and they looked. First thing came out their mouth, well, nobody told me, my secretary, nobody didn't tell me you was here. It's like, I don't know what to say, it's just so much. I learned from this that I'm gonna speak up, I'm gonna knock on many doors, and I'm gonna keep coming and keep coming. I'm gonna be after you, because things gotta change. There's so many cities out here Medicare and Medicaid, they don't even have. We're not just thinking about home care associates, or we think about everybody, because one day we're going to be sitting in their seats.
That's right.
So we got to think about our future too.
I think that there is power in numbers. So to be a member of an organization that, like we recently joined WIPSA and went to their conference, and they had lobbied for.
Can you share what is WIPSA? What is that?
WIPSA is Wisconsin Personal Service Association. And so they really fought and advocated for a raise in Wisconsin for the personal care rate that hadn't been increased in far too long. So I don't think any one individual entity would have been able to accomplish something like that. So to be able to band together and to get bigger asks like that, I think it's important to be able to be involved in those kinds of things. But on the other hand, people aren't going to fight for you like you're going to fight for yourself. So you also have to be willing to stand up and speak for yourself as well.
Yeah, go ahead.
We were just earlier about how where you start advocating, and my experience as a caregiver is you advocate for your clients, advocate for yourself in your doctor's office, advocate for yourself to your landlord, advocate for yourself and your family in all these different ways, and all of that is experience that you where you get where you are.
Yes, and most definitely because even for my clients, I don't shut my mouth. It starts with me. And whenever my client have a problem, we have to follow rules and policies too. But once I get the okay, I'm going for it. So, when the client can't speak for itself, you're right, you speak for your client, you speak up for them. They might not have the education, they might not know what certain words mean, you tell them what it is before they sign the dotted line, you know, or before they switch over to something that they don't know they switch over, before they switch their benefit and this benefit was better for them. You have to advocate for your clients. You definitely do.
Rebecca, could you share the story of what happened at the WIPSA conference when the state representative made a comment that you weren't too pleased about? Would you tell that story?
Okay. So at the WIPSA conference, Wisconsin has a newly formed task force on caregiving, and one of the state representatives is on that task force, and he was there speaking to us at the WIPSA conference, and he was making comments about how even though caregivers are doing like godly work and they're working in places and in conditions that many people wouldn't work in, and they're doing it for very low wages, they're just earning their way to heaven. And so we were sitting at a table quite close to the front, and my comment was very loudly that they shouldn't have to walk through hell to get there. I'm not really sure how beneficial he's going to be on the task force. But we'll
You go, girl.
Sounds like you were made for this.
There was recently passed, I believe, a Bill of Rights for domestic workers in Philadelphia. I was just wondering if y'all were involved with advocating for that, or and what its impact will be on
We
your
was
co-op.
somewhat sort of involved domestic care workers, but like I said, I sit on the board and stuff, so some days I'm going to answer, some days I don't. But I know that we were more with domestic care workers, that we were involved in how can we basically like better them, and what options can we give them. If I'm correct, you correct myself. We gave them the options, and working with domestic workers, some of them wasn't sure. It wasn't sure. So Terrell, right?
So that is still prevalent for us right now.
Yeah,
It's actually something on our policy action group that we are discussing. Because of the influx of immigrants coming over and needing jobs, we have a trade association we work with that can help with making sure credentials and all of those things are right for those persons so that they can get occupation with us, and ensuring their rights. And as those things are passing through legislation, we are beginning to show up at those meetings to voice for, because we have some already, so we bring them with us as the examples that this works. It's doable. So in our policy action group, that's one of it, along with bringing hospice to rural areas as well. We're looking at those policies as they're set forth now too. And it's all driven through our worker member policy action group.
We have time for one more question.
Can I just say thank you for everything that you guys have been doing? I'm really inspired by what you're saying to us.
I would like to reverse that clap back to y'all, my team. I'd like to thank you and continue coming out, and maybe one day that somebody else will be sitting here telling their story. Don't let my story just become a book on the shelf.
Awesome. So, keeping on my participation theme, So thank you all so much for those of you who participated in the panel, asking questions, being engaging. We wanted to make the most of this time, and after hearing these stories, while it's fresh, give an opportunity to craft your own message. So we talked a little bit about, what does that look like? What are the first steps? Before the first steps, I think, we heard a lot about why this matters. So luckily with those amazing panelists, I can kind of breeze by most of what I was going to say. I think they said it a lot better than I could. But really emphasizing the fact that elected officials and their staff cannot know your story unless you tell them. You heard how powerful stories can be. That's what makes the difference. That will turn legislation. Again, just for kind of brief background for those of you who don't know me, I worked for 5 years in the Senate for Senator Tammy Baldwin.
Oh, wow.
So we had a little connection. But really, we started on legislation from a letter that someone wrote in. We started legislation from a newspaper article that we saw in the Milwaukee Journal-Sentinel. So you really don't know what it is going to be, but telling your story and getting your message out there is going to make the difference. And again, kind of in the reverse vein, they are not home care workers. They are not members of a cooperative. Well, they probably are, but they probably not. A member of a credit union or some other cooperative. But again, telling them those challenges, telling them what the challenges you face with wages or with licensing or all of the many issues. We talked about it being a very cross-sector issue, so sharing that with them. So how do we advocate? There's a number of ways. We heard a lot of them. I'm going to make a small plug because I think this is influential of letters to the editor. Community papers, they read them. A lot of offices read those papers. And if you write in there how home care cooperatives are making a difference, what the challenges you're facing are, there's a really good chance that they will see that. And if they don't, you can send it to them in an email. I also recommend that. And then, of course, meeting with your elected officials, that face-to-face conversation, building that relationship, and not seeing these meetings as a transaction. It's a lot easier to make change when you have that pre-existing relationship with someone. Going there only when you need something is a little bit harder to do. So telling them when you have successes is also awesome. So starting pretty basically, finding your elected officials. Google is your friend, right? City websites can be hard to get to. State officials, state maps are often very gerrymandered, and it's sometimes pretty tough to know who your elected officials are. So finding those zip code finders, using those resources, and using resources through membership associations. Someone had mentioned the U.S. Federation of Worker Cooperatives, other other associations that you're all members of. They have that information available to them. You're probably paying them dues. Use that. That's what they're there for. So to set up a meeting, so I will also take a step back that because I was a federal staffer, a lot of this may say member of Congress, U.S. Senator, things like that, but don't let it be limited to that, especially because in our workshop, you'll have the option of who you want to be talking to. So whether that's your city, county, state, federal, or anybody in between, apply that to all of these. So contacting them directly. They have a phone. You can call them. Calling and asking to set up a meeting. Who handles, whether it's a workforce issue or I handle healthcare. And a lot of times, I do not love the telephone. You can find it on their website. Once you find out who you're trying to meet with, they'll usually have a scheduling form on their website. And if they don't respond immediately, you can always follow up. So I've always found it helpful to include more details so that you're directed to the right person. I've always found it a little frustrating when I've tried to set up a meeting with someone only to find out that this particular issue isn't within their portfolio, and then they kind of get a glazed look over their eyes. So giving them information on the front end is also helpful. So thinking about labor and workforce challenges, Medicaid-related issues, and things like that. So I picked a few policy challenges that I have heard emerge Some of them incorporating as a cooperative, things like access to finance, things like wages and reimbursement rates. Those are directed at the state level, but have federal implications, right? Are there other, just off the top of folks' head, what are some other policy issues that you would think about engaging with your elected officials?
Housing.
Sorry, I didn't hear that.
Housing.
Housing, yep. Anything else related to your, yeah?
One that came up from the meeting this morning was that SBA has said that it would do loans to co-ops and they're not doing it under this administration. So that's a federal issue.
Yes, absolutely. So the Small Business Administration, cooperatives are the only type of business that cannot access financing from SBA. That's a problem. So there's, mobilization efforts around that. It's SBA federal level, exactly. And so educating your U.S. senators and U.S. representative on that issue. Yeah?
I have a question.
Go for it.
Around accountability with payment of public pay dollars, I feel like there's an opportunity to hold the government accountable, and maybe these, I know it's like the EPA has been sued several times, and then regulations get implemented. Is there anything that could happen like that here in this sector, and if so, what type?
Yeah, so this would be a question for Tim if you were here. So I don't have the exact answer, but typically government officials, I'm going to put a big old asterisk on this, but typically government officials want accountability, right? They want to know that the dollars that they are using of taxpayer resources are going towards the thing that they said it would do. And so again, in theory, that should be there. So I think talking to folks at, whether that's the state or federal level, of how are we tracking that? What is the missing data? If you have X, Y, and Z data, still what part of the picture aren't you seeing? And they are not in this field, so they don't know kind of what they should be looking for. So it's helpful to frame that for them.
Yeah, how helpful is it if you make it more personal? Because you're talking to people who might have caregiving issues, have spouses, and it seems to me that, we could go to all the statistics and data, but if we can make it personal, I think that would be better. I
think that's exactly right. And using that personal story, and
they did mention that.
They did mention that. Exactly. But so part of the reason, and I can speak to this, part of the reason that Tammy Baldwin was so interested, because at that time her mom was receiving care, and she was a U.S. senator, so she couldn't be in Wisconsin for most of the week. So having the faith that that was someone she could trust with the person who she loves the most was a big deal. So it does. Everyone has someone at some point who will care. So I think there is. I think it's dependent on who you're talking to, right? Some people aren't very receptive, but so are more driven by data, right? And so having that in non-cooperative home care providers, the turnover is as high as 80%, but in cooperatives that is below 30%. Knowing that annual workforce is such a difference in the cooperative model can also be an important detail. So thinking of what their priorities are as well, and kind of speaking their language a little bit. Yeah.
Kate, I'm involved in a group I'm from Boulder, Colorado, and I'm involved in a group that's helping write planks for the platform for one of the parties for the upcoming election. So, and it's tight. It's within the next 45 days for most parties, but it might be something that some of us here might want to take part in, go find out from your local party. This is a county-wide one that will then go into the state platform. So there's still time to make sure there's something about the needs of the community we care for and care about. Make sure their voice, speaking of voices being heard, that's one place to make sure that we as the providers and they as the consumers we all have our voices heard.
Yeah, I think, and the campaign side of it is a little bit different, but it equally is important.
Yeah.
NCBA actually recently put forward an open letter to presidential candidates. There was 1,000 of them. And so we should include cooperatives in a number of policy solutions. And we saw, 8, which again, big field, but 8 people, 8 offices, or 8 campaigns rather, contacted us about how they can be including cooperatives. One candidate had a whole plan on how cooperatives are serving rural communities. So again, making that contact with them and getting on their radar is a really good way to make sure that they know about it. Yep.
One of the health organizations that I work with, one of the things when you're advocating and you go into this through your state legislation, what we did was we talked to the ones that were for what we were going there for, to give us names to the ones who was against. And we made a day out of talking to the ones that were against what we were going there for. And they were just blown away. Somebody had came to talk to them and asked them questions. They said, even though we were advocating for something that we knew they were against, they said no one had ever just come to them and just sit down and talk. I was like,
Exactly. Again, talking to them is like, it cannot be overstated how important it is to just be communicating with these offices. So this is a perfect segue. Learning about your elected officials. Learn about them before you go. What committees do they sit on? What bills do they openly oppose? And how are those impacting your work that you can change? And I think, committees are a really great way at both especially the state and federal level of thinking, a lot of them are pretty broad topics. And so home care can fit in a lot of them. It's not just committees on aging. It's not just committees on workforce. It crosses a lot of sectors. So, we've been over this part of it, but I will continue to harp on this. So if you walk out of this room and only remember one thing, remember that your story matters. What was it like for you to become a worker owner? How has that changed your day-to-day? Not only in kind of the economic sense of what people might initially think of, but your mental health, your communications with your clients, things like that as well. I think, again, we've had folks compare it to non-co-op businesses that they've worked for before, and honing in on that cooperative difference, I think, is a really powerful part of people's message. And then, we have heard over and over again the different ways that you are investing in and serving your community, and I think that is always going to be a powerful part of the story. So I have found it helpful to come prepared with 3 to 5 talking points. I also get very anxious, and so having bullet points of things that are easy for me to remember. Sometimes I make them into the, so I can remember acronyms when I'm really nervous. But thinking about what are the top points you have. Sometimes elected officials will not have an hour to spend with you. I know in the Senate they'll often have 30 minutes that they'll dedicate for the, this initial meeting. So thinking about in that amount of time or less, what are the points you want to share? And so your story is a huge part of that. And then going back to thinking about the policies that you want to change. I think a lot of it is topical. If you know things as specific as the SBA is not guaranteeing loans to co-ops, and so we can't access financing, that's awesome. If you also know, we have a workforce shortage, and here's this problem, that's enough. You can tell them the problem. It is actually their job to find the solution. So putting that problem on their plate and letting them know, you're there as a resource, but this is the problem you need them to solve. And I think I got ahead of myself. Sometimes it is a really easy request. It's really straightforward. It's easy to understand. We need funding. Great. sometimes it's a complicated issue. It's not easy to talk about. It's not easy for people to understand. A lot of people do not understand what a co-op is. So it's like, all right, we going back to the 1800s, or are we going to do like a recent history? How are you going to make it in terms that they understand? For my Wisconsinites out there, I have had conversations where I'm like, the Green Bay Packers, they are owned by the community members. And they're like, oh, yeah. I'm like, okay, so it's not really a co-op, but it's closer than the other thing. So it's really finding that common ground where you can start and building off of there. And again, and kind of just easy to explain, thinking about building a relationship. You are not going to probably get what you want the first time you ask for it. And so not seeing this as, all right, I checked the box, I did my advocacy duties. It's never ending, right? This is something we always have to be working towards, and just to not see it as transactional. Again, a lot of elected officials and their staff will unfortunately just lack the knowledge specific to your field. Offer to be a resource. Offer them, I think there's probably some privacy implications, but where you can, offer for them to have a field trip. Come see what your day is like. Inviting them to see how your co-op works, how people are engaged differently, how they're not just a conveyor belt of workers, will make a difference. And again, even when you don't have an ask, it's a good idea to be in touch, right? There's a balance, a healthy balance, but if you have something really good that happens, if you have a great story to tell, share that too. As much as when you need something, it's important to let them know when the good things are happening. So I will stop there for questions. Yes, Diana.
This isn't a question.
Okay.
It is a comment about the National Cooperative Business Association and by extension the Cooperative Development Foundation and how important a voice they are for the cooperative community as a whole in Washington, D.C. And I just want to give a plug, if your budgets can afford it, to consider becoming a member of NCBA, who's the only organization on a nationwide basis that supports cooperatives of all kinds.
Thank you. Yeah, go ahead.
About a decade ago, before President Barack Obama was president, he was Senator Barack Obama, he shadowed for a day a caregiver in Illinois, in Chicago. And when President Barack Obama signed legislation to extend the Fair Labor Standards Act, he invited that caregiver that he shadowed to be there at the signing. Is there any way that we could have a campaign to invite some of our elected officials to shadow, to follow in the footsteps of a caregiver?
Yes. Yes, I think that's exactly it. There are so many of us, right? If all of us asked, and all of us told 3 of our colleagues to ask as well, and they asked 3 of their colleagues, right? This is how it grows. And I think making that effort very intentionally of having people see a day in the life of the communities you are serving and the work you are doing is tremendous, and they should see that firsthand.
And like you mentioned, with letting them know of all of the good things that we're doing too, invite them to the celebrations, invite them to your worker owner participation celebration ceremonies, invite them to those things. Some will come, especially if it's their initiative and they want to push, they will come and they'll bring the media with them. So they can get the picture.
That's an excellent point. Invite them to your annual meeting. There was a rural electric cooperative in Kentucky who invited a senator, and that was awesome. But that's 1,000+ people in that room. They want to be in that room as much as you want them to be in that room. And having them there, they will say some things. Maybe you agree, maybe you don't, but then you can work later right on the campaign side of things. But in the meantime, they are in office, and so bringing them into your space where you're more comfortable and being able to say, okay, you got your message out of the way, here's what we need from you, and being able to, welcome them in and being kind and all those things. But having them in your space is a great way for them to start thinking about different kinds of ways that they can be helping your space.
The other thing that I've always found helpful
in getting and moving through like a piece of legislation is to like fix their problems. You know, especially like, for example, with veterans. You know, a veteran will pick up the phone and call a congressperson probably faster than a lot of people. And so I would solve that problem of the guy who is calling the senator's office 5 times a day. I'd say, hey, you know, why don't you just have him call? You know?
Yeah, people are a big fan of you doing work for them.
Yes.
And making them look good, right?
Yeah.
It is a little bit of I'll scratch your back, you scratch mine, and being able to help, because that's also your community member, right? You want to help them anyways. Other thoughts or questions? Yeah.
I got a thought. I was actually thinking like, we're from Buffalo, New York, and our mayor had came up with a program, because I know we are fighting like for raises and all that stuff, and we know we in competition with the restaurant industry. He actually came up with a program, I'm not sure the name of it offhand, about what McDonald's is actually giving people their GEDs at the 90 days, and I was just thinking, that is our problem we can do with home care, keep people off the welfare, get some of the dropouts to go and get work at the same time, and get your GED in 90 days. I think it encouraged a lot of home care workers or future home care workers or your children that want to be home care workers to actually encourage them to want to do it. And we might need some nurses to train some of these people, and everybody can get hired and live a better life.
Yeah. You just found your topic for the group activity. Any other last thoughts or questions before we start on the workshop part of it? Okay. So let's practice. So I think it'll be best if folks rearrange themselves if they're not already sitting with folks from their cooperative or in groups that make sense. I'll just leave it there. You're all smart people. Identify an issue that you want to talk about. There is no right answer, there's no wrong answer, whatever that issue is, I should say, please keep it related to home care and co-ops. So I'll ask just that you identify the issue that you want to talk about, who you would want to meet with. There's, again, not really a right answer. If that's a city issue, a state, or a federal, kind of where you would want to start tackling this issue. And then draft an agenda with your group. So what aspects of your co-op story do you want to make sure to tell? If many people would kind of buy into this, what's the most powerful part of each person's individual story that you would want to share? And then discussing the policy challenges, and if there is a solution that you would like to advocate for as well, including that. So it's hopefully broad enough that you guys will all make it kind of work as for what you need. But I will pause again for questions. I was crystal clear. Okay, so after, we'll give folks a good amount of time. I think it's 30 or so minutes that we've bookmarked for this. So take your time, quality. And then at the end, we will debrief, and it will no longer just be talking. And we'll go around, we'll just ask, I'll give you a sneak peek. We'll ask for folks your name, your cooperative, your location, just in case we don't all know each other yet. What was the challenge you identified? Who did you plan to meet with? And then what were kind of the top 3 things, just given any time constraints, 3 things that you would want to share in that meeting, and then with this group. All right. Break. Thank you. So we are, like I said, we're going to do kind of a debrief and kind of a share out of what your group talked about. So Maya, who is in the back, will raise her hand. I will also make the plug that this is a really good opportunity for those of you who maybe are not as inclined to speak up, to be the one to share on behalf of your co-op. So with that, I think it will probably be easiest to start just in the back maybe. And so if whoever the group nominates to be the person to share, if you would just share your name, your co-op, and where you're from, and then kind of the questions laid out on the screen here. What was the challenge? that you all were bringing up to your elected official, who you plan to meet with to discuss it, and then what aspects of your story did you find the most compelling? And if, yep, thank you.
Hi, I'm Mims from the Courage Cooperative from Los Angeles. Our biggest challenge is really several. It's like since most of our members are like undocumented, so it's a matter of getting people to just getting like fighting for their wages and fighting like for their right, making sure that they're getting paid right, and making like finding clients who are willing to pay the right amount. So our resources like helped us with several lists for like cooperatives to get in contact with, in terms of like helping us set things up so that, because right now it's very small. We only have like about 3 clients and like about 7 caregivers. We would like to expand, but we don't know how. And I think we were given like resources like the LA Co-op Lab, the Co-op Lab, LA, and for example, the U.S. Federation of Worker Co-ops, just to help us address the issues that we have.
Awesome. Thanks.
Okay, so we are actually mostly Washington at this table, and we have, how many of us? Where did you go? I'm sorry. There we go. We have Circle of Life in Bellingham, Ridgeline Home Care in Port Angeles, Peninsula Home Care in Port Townsend, and Capital Home Care in Olympia. Our challenge that we chose was funding to obtain affordable HCA certifications and continuing education, as well as a simplistic navigatable process for necessary paperwork completion. That's long. As far as people to meet with, Nora has already met with a woman named Beth Dolio, and they're working on addressing how to fund where we're lacking in that ability, because it is a really big issue in not just our co-op. Is we have so many people that are like, oh yeah, we want to do this, but we can't afford to shell out almost $1,000 to do this. So as far as personal stories go, I will probably just hand this off to you after I'm done, because we just, and whoever else wants to go. We actually focus more on potential solutions, and Jane had this amazing idea that actually Circle of Life has been discussing in similar avenues about having someone akin to a certification completion manager that would guide workers through processing and finalizing paperwork, tracking CE, scheduling classes and testing, offering resources to reduce potential barriers such as childcare that's shared and paid for between all of the Washington State home care cooperatives. Another option was state-provided testing instead of third-party contracting to control cost of testing to make it more affordable. And we were also talking about the potential for a cooperative testing and training agent trained to share across cooperatives in Washington State to offer reduced certification costs to co-op members. So, and then as far as the story for the compelling nature, I'm going to hand this off to Clarissa.
Hello. You want me to stand up? Yeah. When we were just talking about simplifying the navigation in terms of getting your certifications online and through the DOH and DSHS, I was just talking about an experience that I had when I was first starting out trying to get my HCA. I didn't know too much about what the navigation process was for applying online and how to basically check and see where I was at in the application process. And I recall a story where I kind of just, I just remember feeling really confused about how to navigate the DOH website and the state websites and trying to figure out where I was at in the process, and that kind of sent me for like a little bit of a loop. And then as I was trying to get my individual provider certifications and all that stuff set up, there was a lot of confusion, I remember, about whether they had my HCA or whether I had to do training or not, and people just kept calling me trying to figure out where I was at in that process, and I had to talk to 3 or 4 different people each time about that I already have the certification and stuff like that. So just simplifying that kind of process would definitely be beneficial.
I can talk pretty loud. Can y'all hear me? Yeah. Do I need this? So I'm Deborah with Cooperative Care in Wisconsin. What we kind of talk about is our issue is the recognition of the caregiver position. You can talk about the reimbursement rates, you can talk about those kinds of things, but in order to get a higher reimbursement rate, the powers that be need to recognize the position. Because you can't say, well, hey, we want $21 an hour for that rate, or we want this. When obviously there are people who think we're just working our way to heaven, we don't need anything. We don't need anything else. So we felt that it's more important to talk about the recognition of what that position is and what it really does and what it does for our communities and our economies. We talked about our 5 counties surrounding area has IT meetings. We are aware of 2. And those meetings have somebody from DHS there, somebody from Adult Protective Services. It's just like a round table group. Becky and April were just recently invited to come to one in Marquette County, so seat at the table to just start that conversation. And then we also decided that maybe we'd want to get on the agenda for a economic development committee to talk about the economic impact that caregivers have, whether we think about it or not. We go to provide care to somebody at home so that a daughter can go to work, maintain jobs in the community. The one-on-one care helps us keep people at home, which means they're not selling their house and moving out of the county. They're not moving to a nursing home in another adjacent county, keeping their money and everything, right? So there's a lot of economic influences, to recognize. So we didn't get to the stories, except that we all know our story. We know what the caregiver's story is. We know what the impact is that we would have. So.
Thank you so much.
The family story, I think, is a little more what we tell. I think we have some clients that would probably, come to the table too and say, here's how valuable it was to me. So.
Go in the middle. Yep.
I'm the loud mouth. Okay, and I took advantage of this opportunity to pick everybody's brain. We're trying to start a co-op in San Antonio, Texas. And we're going to approach the mayor for funding. The city wants to show that it is working towards equality for women, towards equality for immigrant women. And like California, Texas is a border city. Town or state, something or other. So Texas, we have a lot of immigrant community, a lot of undocumented women. And yet the city made a survey about the impact the immigrant community has in the city. And it amounts to billions. So having this opportunity to talk to the mayor about how there is rural funding for co-ops. We need urban funding for a co-op in San Antonio. And trying to use the issue of how the city is a segregated city, how it would help equality, bring the inequality, lower that aspect, remove a lot of the poverty that exists in certain sections of the city, allow for opportunities to kind of combat racism. So all these issues, and the ladies had a whole bunch of things that could be remedied with the mayor and the city helping fund a co-op in the city. And personal story, I haven't shared mine, I will share mine now. I was a construction estimator. I used Excel spreadsheets to the max. Anyway, when my dad had a heart attack, I abandoned my career to take care of him. It was a tremendous impact on my income. I realized that care does not pay, you get no respect. So I feel that if I had continued in my career, I could have contributed my taxes better to the city, to the state, to the government. But because my pay was knocked down to practically zero, I could not participate in the economy like I could have. So a lot of women are affected in the same way. Professional women leave their professions because there's not enough people in care. And how this would help those affluent communities as well as the city and the people in poverty. So it's a win-win.
Thank you so much.
Hello. Okay, so I'm Samantha from the ISK group. So our group, we are at our state rep's office, and we're asking for more funding for home care co-ops to go for wages and benefits, funding through Medicaid. And the major problem that we're addressing is that our seniors are not receiving enough care. They're not receiving care at all because of the workforce shortage. And those that are receiving care are receiving interrupted care. The reasons for this, the workforce shortage, because the jobs are not well compensated. People can go, like I'm hearing, to McDonald's, they get paid better. And the reason for the interrupted care is that, you know, when caregivers are not well compensated, they're struggling to pay their own bills and take care of their own families. So they might have to leave their patients home to go, you know, they can't provide quality care when they're distracted by what they have going on at their own homes. And so home care co-ops, actually, because they you know, take better care of their workers, they have a lower turnover rate. And this continuity of care is critical to combat isolation among seniors. It's the home care workers, the caregivers, that have the closest relationships with patients, even more than nurses oftentimes. And sometimes home care workers, or often maybe, know more about what's going on with their patient's medical story with their day-to-day life than the patient themselves, as J.C. Juan-Carlos is going to tell us.
So, hi everyone. So one of the personal stories that we talked about was how sometimes not sometimes, but most of the time, the direct care workers know more about the health status of the clients than the clients and their families know themselves. And when they go to the doctor's office, they should be the ones who are asked. Oftentimes they're not, but they should be the ones who are asked about the status of the client's condition. It can come into identifying the progression of those regressive mental disabilities that members will have in developing dementia and Alzheimer's. Yeah.
I think the other supportive argument that we had was the cost and savings analysis. So we talked about the care savings, but I think the other piece was without adequate funding, cooperatives will close, and having that number of workers and clients in the legislator's district would help, as well as any other data we could bring.
Okay, so again, Medicaid and Medicare reimbursement influences a lot. Some of the things which we have all talked about here, the lower reimbursement rate impacts the quality of care and also the quality workforce. So some of the people, we've kind of looked at this as an economic development as well as a health issue, not only for the workers but for the clients. So an example, like the lack of investment in this Medicaid and Medicare reimbursement, when majority of the work or the market depends on that reimbursement, makes it hard for us to support the workers. Examples are like in our state or in our situation, we have a lot of worker moms, so they're not able to afford childcare. And then there's also not childcare for like around the clock childcare, so that they can be there for a second and third shift. So basically, talking to like the City of Madison, economic development, community-based organizations, and the mayor to increase the infrastructure needed for this workforce, the home care workforce. Because we do that, we're able to address the shortage of caregivers, providing dependable workers to the home care, and people who need home care. Support families, both the family and the worker. Increase child development, because a lot of our workers have to work like multiple jobs and they're away from their families, so socially and emotionally, those children are like suffering because they're probably in an environment that's not healthy for them, because they have to make ends meet. Increase in work performance and health, because stress, not being able to know where your child is or your loved one, like your mom, makes this detrimental to your mental and your physical well-being. Did I touch it? Okay, I think I did everything.
What's your name?
Oh, I'm Georgia. Georgia, Florida, Independent Cooperative Management. I'm so understand
Good afternoon, all. I'm Ramos Wheeler, and this is Myra. Myra is the Executive Director of the Mississippi Association of Cooperatives. This is my wife, Earlene. Earlene and I run a business called Jubilee Ranch. It's a cooperative, and Mississippi Association of Cooperatives is a statewide organization, and our Jubilee Ranch is a member of the MAC. We also run healthcare businesses, and that's basically our challenge. Mississippi pretty much only allows agricultural co-ops and electrical co-ops. So we are trying to start a business that will have to recognize Mississippi. So that's just one of the things we're working at. So as we have talked together, Myra, Early and I, and some other partners are creating an organization called Sisterhood. And Sisterhood will have one primary responsibility, that's to improve health outcomes for urban and rural individuals in Mississippi. And as we look to do that, we've got to start to talking to the state legislators about how to make sure that these kinds of co-ops will be available. We're already doing the work now as a private entity, but it will be much better if we can do it as co-ops. And the reason why we think we're better as co-ops is because we already can give them data showing that if you put a community health worker in a community that he or she lives in and create a health house in that community where they are, that we can reduce healthcare costs tremendously. And we did a demonstration project with some CMS funding, and we had a kid, and there were several of these, but this one kid was a frequent flyer to the emergency room. He was going about 14 to 15 times a month, costing about $80,000 a month just in emergency room visits. We put that kid with a community health worker. They figured out exactly what the problem was. The kid had mold in the house. And so once that community health worker did the home assessment, got the kid out of the house, kid came out with school and started going to school every day. So we saved $70,000 to Medicaid on that one kid. The other thing is that if you could get these programs set up as cooperatives, we can start to do some business development and reduce unemployment, wealth outcomes will increase also. And finally, if you want to change health and wealth outcomes, you got to equip people with the tools to do that. And what a better way to do it than doing it through a cooperative. So that's our challenge, is how do we get our state legislators, Secretary of State, and other leaders to allow these kind of cooperatives.
Hi, my name is Marina, and we are Healthcare Worker Rising from Buffalo, New York. Our challenge is developing a co-op to better meet the needs and opportunities for the community, the clients, and our caregivers. We are going to meet with local senior services to put us on the first list of referrals. We're going to have at the meeting 2 workers to share their stories and their experience, and we're going to have a client to also share their stories with us, as well as experts from University of Buffalo and the ICA as well, and to let you guys know about the other 2 component key points we'll be covering. It's going to be wage theft and lack of quality care. And I'm introducing Shamika to let you guys know about a worker aspect.
Hello, I'm Shamika Murray, again with Healthcare Workers Rising. One of our sponsors is $11.99. I experienced wage theft. I used to work so much to the point that I never even seen what my paycheck looked like. I just knew I had money in direct deposit in my check. Worked it so much to the point that I go from one case to another, didn't know I was supposed to get paid for it, never still did. I even paid for my own cab service, rentals, even rode bikes from one city to another. It took me 5 hours, et cetera, walked 2 hours. But as far as the wage theft part, it was like a month and a half that went by, and I talked to the office and let them know, like, well, how about I'm getting paid for this one case and this other case, and I'm coming from this case to this case. They're like, oh, we'll give you an extra $1. We'll give you an extra $1.50 for your other case. Mind you, I didn't know I was supposed to get paid to travel from one case to another, so they didn't give me money for that. And the only way I found out that I was missing money is when my car insurance got canceled for $1.79. And I'm like, nah, I can't drive my car, so how do I still get to work? So now I was like, okay, now I gotta walk to get to work, and I got a car sitting in my driveway, and I don't want to get my car taken away or get it a ticket, which I have been in situations where I have got tickets or my car towed or taken from me because of those situations. So that's my experience with wage theft and even working, living cases, not getting no breaks for almost, 2-3 months. Wow. Besides those other cases I work too. Sometimes I work about 4 cases in a day or more. First, second, and third shift. I was a very hard worker, but I still love the work I do. And that's why I'm here.
Our total. I'm Katrina Pope, and what is that? What's the name of my cooperative? We just gonna call it Washington D.C. Cooperative. We don't have a formal name yet, and hence the name. We're located in Washington D.C. And what we see as some of our challenges, more importantly, we live in a district where so much money, capital flows, but we have a health crisis. So we have not just crisis, we have health disparities as well, because within 5 miles of one section of DC to the other, the lifespan longevity is 10 years. So a senior can live in Southeast, the average life is around 70, is it 70? 70, 72. We're on the other side where there's a little bit more income. People live till late 80s, early 90s. So, and I want to say that's about care, right? Quality of care. But we also have some that's economic and business development issues, and more importantly, we have public health issues. And some of those are in terms of us getting our cooperative off the ground. What we see as a challenge is that we're in that actual spending cycle. Like, how do we get out the starting block? How do we secure funding? And how do we, get this feasibility market study, all that stuff gets moving. So what we have decided is that we will go to our seasoned senior council person who actually has the oversight for most of the cooperative pieces and some of the departments of health, and we will also try to connect with some of the connecting organizations that have ancillary pieces to be able to increase our ability to get some funding and do some innovative programming. And what we really seek to do when we talk about our personal stories and how our cooperative, what we most identify with, when we talked about the health crisis, we're more specifically looking at, we had 2 major hospitals closed, and actually those were in, I want to say, areas where there is high levels of low income, and also high levels of morbidity and mortality going on in those communities. So looking at that, and how do we try to rectify some of those issues through the cooperative. So we have a few stories around that, but also talking about the workforce shortage. So some of this stuff is kind of redundant because it seems like we all in here together trying to get some solutions around the same issues. But I think my partner Sharita has a great story to talk about her mother and how she, as being in that sandwich generation of caregiving, and how it's impacting her, and not just her, but the overall. Because I know I'm in the middle. I have my grandmother and my mother, and then I have my kids and my grandkids. So, and I'm 50, and I look good, but anyway. But it's a struggle, because I feel like the young lady in the back, because here now, I'm thinking about career changing, because I know that my mother's probably, longevity runs in our family, she'll probably live, and my grandmother is just too, she's cute like me, so she just won't keep perpetual. So anyway, here you go, Sharita.
Well, I wanted to share in taking care of my mom initially, before I went back to work, they informed me that while you were out, we reorganized. So that was an abolishment of that position. And then when she came to live with me, she had another stroke and a seizure, so she had to go into rehab. And then she had to go to the hospital where she had a heart attack and got stents. And she's still here and still fighting, but in being in rehab, in her going to the hospital to get the direct care that she needed, because of the hospital situation in DC, they said they could not give her an appointment until January. This happened 2 weeks ago. So it is that type of thing that we are constantly facing. And where was it, Rebecca, when she was sitting up there, when you go from being in a facility where you're on a timeline of how many people can see as opposed to actually being a care worker, it affects the patient. Because as my mom said, she said, I feel like I'm getting worse in here. And so do I make a choice of losing or quitting the job again to take care of her? So it is a critical issue.
Wow.
I'm Jane, and I'm here with Everyday Details Home Care Co-op from Asheville, North Carolina. Our central issue that we came up with is how to keep funding coming after our startup was basically funded through a grant from the county, which was really a wonderful program, but now we don't know if that's going to continue. And even though we've had 3 years and we've hit some major milestones, we've done our business plan, we've got our operating agreement, we have our pricing almost finished, we have our logo, all this stuff, we have our board set up, we know who our customers are, we have different strategies for our customers, we've done all this great work. But it takes a long time to get a business off the ground. And so we need another, at least another 3 years if we could possibly get it. And so we are going to the county manager right here to ask for her support. And let's see. Yeah, that's pretty much our issue, our challenge. But we thought we'd also tell you a story of the kind of client that we work with and why it's critical to get this funding.
Okay, so the clients that we work with are high-risk clients to begin with through our ABIPA organization, Asheville Buncombe Institute of Peer Achievement. Everyday Details is a branch that came from the direct work that we already do. So what we found was when we go into people's homes, and we usually get referrals from different people all over Asheville, but Mission Health Partners, which is the largest hospital, is one of the people that refer to us. And one of our clients was referred because he wasn't going to the doctor. And so I had to go in and find out why is this. And it becomes that he has cognitive issues, he has some serious health issues, and he really wasn't going to the doctor. So I was able to refer him to our Everyday Details because he needed his place cleaned, because he could not do that for himself. And our transportation person has to take him to the doctor because he didn't have transportation. Now, this being said, the same client is very contrary, and we don't know if that's due to his cognitive issues or if he's just contrary. It really doesn't matter. So his thing is that if you want him to go to the doctor, then he's going to not go to the doctor. So you had to fill out a delicate way to get him to be compliant and go when he needed to go for serious health issues that he has. So you have to be an expert in your field and be able to relate and figure out when to back up and when to go in. And our team is very good for that, including our transport person. And as you can see, JJ, he's got a real nice disposition, but he's also very tall and he's very strong. And so most of our clients, he's very respectful with his care when he takes people to the doctor, but he's also, who's going to talk to him? So, and then our ladies, they know how to talk to people, and a lot of the clients still just say, oh, we just love them. And he said the same thing. He goes, those ladies, they were so good to me. Those ladies and our nurse and our LPN who has to go with him sometimes, because sometimes when he goes to the doctor, I need someone to be able to come back and tell me exactly what was going on and be able to relay to the doctor what I need them to relay. So our team has wraparound services for our clients. So we want another, county manager, we want another $100,000 for 3 years so that we can continue with this type of care and help the people that are in need of our help continue to get well and cut down the high risk in our emergency rooms and in our health care.
side, but I was not. I'm holding the mic now. I'm Autumn. I'm a new cooperative developer with Keystone Development Center. We do technical assistance across the Mid-Atlantic for lots of different co-ops. And we had lots of different co-ops here at the table. We didn't necessarily group with co-ops who are with our own club who's working on the same project. But it was great because we got to hear from an existing, though young, cooperative in New Mexico, in Albuquerque, kind of municipally backed home care co-op initiative from Puerto Rico, and a kind of startup in Washington, and the perspective of the developer. So we got to hear lots of great things around the table, identifying potentially maybe a common need, something that's being provided, something that is seen as a need, and something that is being provided by a municipality on a kind of pilot basis of training. So to do some of the upfront initial training, and maybe pushing our representatives to offer that. Do you want to say more about it?
Just a little. Yeah, so at this table, we have New Mexico, Puerto Rico, Pennsylvania, Washington, around the country, all these areas represented, and we're all having the same problem once we start talking about our issues, which is staffing, which is retention, which is quality of service, and like you said, 80% turnover for for home care companies, 30% for co-ops. That's a 50% difference. That turnover is representative, that also reflects things like abuse and neglect, and the reason why we have to let people go. You hire slow and you fire fast, and that's a hard way to run a business. And so I kind of wanted to just recap my idea I asked you about earlier, which is basically to petition our departments of health, respectively, of our areas at the Senate level or local level, to allow us to do these trainings for free, because basically the Department of Health asks, up to $1,000 per person to certify, just to get started. And it's 120 days that they can work with no training, and then that 200 they got to take a test. By then, all hell can break loose for, as far as the things that can go wrong. And as being someone who's part of quality assurance for a large company for a while, and talking to clients and finding out all their complaints and looking through all the horrific things that have gone wrong with people with no training, essentially the state itself could resolve a lot of these own issues by taking more control of the certification, and not just saying, well, you took a class, or here that you read it online and you took this thing, good luck in the field, and all of that, systemically, you could actually bring down incidents of neglect and abuse and abandonment on all of these things, and raise the quality of care, and lower the cost of companies that can't afford to put $1,000 in every person. On top of all of that, the best caregivers I've ever met are moms, because you've already done it. You've already been there, and you've already dealt with the worst things you're ever going to face on a personal level. That how many moms have time, 8 to 5, Monday through Friday, during a school week, that they can put into care, but don't have that money for the startup to get into this kind of work. So that would put a lot of people back in our workforce. We get a lot of people working again, and more people involved in healthcare that never thought they could or had the ability to. And as they move along in life, they could become doctors or senators or Department of Health workers, and move in and actually better the entire system.
So we're, as I mentioned when I was on the panel, we are actively working with a lot of task force on a number of different issues in our policy action group. We have wages, we have domestic workers, we have reimbursement rates. So in our policy action group, those different officials are working with whether it's federal, state, or local legislation to push those initiatives. And when we do that, we take the people to the meeting. So it's not, for the stories, we take the consumer, we take the aide, we take the family, we take those people with us so that they can tell the stories in real time, so that they can see and feel it from those parties. So I'm not going to take up too much.
No, that's great. Thank you.
says 4 o'clock, so I won't go too much over. I'm going to go a little bit over. But just really to say thank you. These stories mean so much to me and my job, and it makes my job a whole lot easier. And I hope that you have learned something in this workshop, and hopefully have maybe found some empowerment in it, and will maybe engage in some advocacy on your own. But truly, I think these are, you called it a crazy idea, and it's like super well thought out and awesome and great, and you should tell it to people, right? Like, this is an important place to start the conversation and take that to the next step. So again, truly thank you so much for participating and making me very, very comfortable up here, and what is normally uncomfortable. But I will also, Diane mentioned NCBA, where I work, and I will also give everyone a very low-hanging fruit opportunity to try advocacy, because at the federal level, we have a cooperative business caucus. So members of the U.S. House will join the caucus, demonstrating their support for cooperative businesses. So we are trying to build up that support by educating members about cooperatives and about the caucus. So I would highly encourage you to visit house.gov to find your U.S. representative, if you don't already know who that is, and write them a letter and ask them to join the caucus. It's very simple, telling them about your co-op. We have more information on NCBA's website. There's also a postcard out there where you can find me. But just giving it a try, right? Like, what's the worst that can happen? So as someone who read mail for 5 years, it makes a difference. Things come out of it, so we just really encourage you to do that. With that, I will turn it over to Leslie.